Hello, dear students. Welcome to Nutrition Support in Cancer and HIV. This chapter is extremely important, especially for cancer patients. Um, Also for HIV patients, but I think we have a huge population of cancer patients in US, right? Cancer and HIV share a direct relationship with the body's immune system and basic nutrition needs. Their courses and outcomes are distinct. So the section 1 of this chapter is going to be cancer related, process of cancer development. Let's navigate through the definition and how this disease is developed. It's not a single problem, cancer, right? It has a highly variable nature and it expresses itself in multiple forms. Cancer is the second leading cause of death in the United States. It is responsible for 21% of all deaths, 21%, whereas cardiovascular disease causes 23%. So in a few years, if we don't control this immunological disease, probably is going to get to similar percentage as a cardiovascular disease. We use the term cancer to designate a malignant tumor or neoplasm, neoplasm disease, right? The many forms of cancer vary in prevalence worldwide and change as population migrate to different environments. Huge statement here, huge statement if you can read behind the lines. The many forms of cancer vary in prevalence worldwide and change as population migrate to different environments. So what is the takeout of this? Environmental disease. You can be healthy, but if the environment is not appropriate, when I say environment, I'm not talking about the climate. I'm talking about the environment through water, through toxins, through food that is not healthy, that has many genetically modified ingredients. Okay, the environment of the cells, that's what I'm talking about. Environment of the cells, the fluids of your body. Okay. Also, we have to consider cultural factors. The incidence of cancer in American populations outlines the prevalence of cancer in the U.S. relative to race and ethnicity. Okay, so the genetic code contained in the deoxyribonucleic acid DNA of the cell's nucleus guides the continuous process of cell division. A mutation may disrupt this orderly process, particularly when the mutation occurs in a regulatory gene, means one of the main genes, okay? Growth of a mutated cell may form a malignant tumor when normal gene control is lost. So when we have this DNA chain, there are basically 4 genes, right? 4 genetic codes. And if one of them is out of control, then the whole genetic production is going to be compromised. Thus, the misguided cell and its tumor tissue represent normal cell growth that has gone awry. Malignancies are identified by their primary site of origin, their stage or tumor size, the presence of metastases, and their grade. Again, malignancies are identified by their primary site of origin, their stage, their primary site of origin. What organ is it? Their stage or tumor size, right? Is it a small, a big tumor? How many lymph nodes are compromised? And then the presence of metastasis, to what other organ this disease is expressing, okay? There are 3 phases of carcinogenesis. Genesis, the creation, cancer, creation of cancer, 3 phases. Initiation, promotion, and progression. Initiation, and that's good to know. Initiation is the point at which a mutagen causes irreversible damage to the DNA. So one of those four genetic codes is damaged and is irreversible. That's initiation, right? An agent that prompts the mutated cell to grow and reproduce initiates the promotion phase. Okay, and the progression is the phase during which the cancer cells advance and become a malignant tumor that is capable of metastasizing. Cancer cell development. The underlying cause of cancer is the fundamental loss of cell control over normal cell reproduction. Cell control over normal cell reproduction. Several factors may contribute to this loss and change a normal cell into a cancer cell, including chemical carcinogens, radiation, that includes your microwave usage. Oh, what, Dr. Matalana? Yes, maybe the microwave radiation is not as strong as your mammogram radiation waves, but still you are receiving radiation through food. Highly recommended avoidance of microwaves. Okay, so let's repeat. Loss and change a normal cell into a cancer cell, including chemical carcinogens. It could be the carrageenan, right, that we mentioned in the first lectures, that is an ingredient included in different canned food, like regular canned milk. Okay, chemical carcinogens, radiation, dietary factors, also carrageenan, oncogenic viruses like human papilloma virus, okay, and epidemiologic factors, race, age, heredity, occupation, okay, occupation. What occupation, doctor, is epidemiologic? For example, the rescuers at the 9/11, okay, they were inhaling these products, and it became, their occupation became their the highest cancer risk, right? Most of them are having right now lung cancer. So this chapter focuses on cancer development and treatment, and it relates to nutrition. Dietary factors. Food naturally contain both carcinogenic and anti-carcinogenic compounds. Oh wow! Foods naturally contain carcinogenic and anti-carcinogenic compounds. Researchers have documented the connection between some dietary patterns and a specific form of cancer, such as diet high in processed meat or meat cooked at high temperatures, and the risk for, let's see, the risk for colorectal and stomach cancer. Such a what? What is an example of that? Your meat cooked in barbecue. You use charcoal, right? You use charcoal. Do you think that is carcinogenic or not? So cultural considerations, incidence of cancer in American population. We can see percentage of adults with cancer according to race and ethnicities. The higher risk is white. And then we have American Indian, Black or African American, followed by Mexican, Hispanic or Latino, and Asian. Okay, so a general consensus is that obesity and a poor diet, I define as low intake of fruits, vegetables, whole grains, and dairy products, and high intake of processed meat, red meat, alcohol, and sugar sweetened beverage. There you go. There you have your processed meat, red meat for barbecue, cooking charcoal, and then you have colorectal and stomach cancer, right? High risk for that. That's a well-balanced Mediterranean diet, which is rich on vegetables and fruits and fish, right? And my plate dietary patterns, my plate, right? You should be familiarized with my plate. Half of the plate is going to include greens and vegetables, and 1/4 is going to be your protein, and the other quarter is going to be your carbohydrate portion, which is similar to one fist, right? Coupled with regular physical activity that supports and maintains a healthy body weight is the general recommendation for health promotion and cancer prevention. Again, so you have your Mediterranean diet, which I really I experienced great benefits when I did my capstone project in breast cancer survivors. We the study was done on women postmenopause that were having obesity. So with the Mediterranean diet, we were able to lose around 80 pounds in 10 weeks. Okay, so the idea was that by reducing obesity, they were not going to have recurrence of breast cancer. So far, after 4 years, 5 years of the study, none of them had a recurrence. Okay, it's thanks to the Mediterranean diet and the physical activity and weight loss. So we have the normal epithelium here in this graphic, the pre-neoplasia. You can start seeing how the irreversible damage in one of the components of the DNA causes these changes. And then the invasive cancer. Probably these cells are ready to metastasize. So this is the picture of one cell. So when we have a tumor, are millions of cells, right? So we have in the host factors, the genetics, epigenetics, microbiome, age, gender, and then environmental would be the food contaminants, viruses, UV radiation, environmental carcinogens, and the diet, lifestyle factors, nutrients, energy intake, phytochemicals related to plants, other food components, alcohol, physical activity, smoking, other lifestyle factors. The body defense system. Special cells protect the body from external invaders such as bacteria and viruses, and from internal aliens such as cancer cells. So defensive cells are the lymphocytes, which are special types of white blood cells developed early during life from among stem cells in the bone marrow. So those are the pluripotent cells that branch out into myelocells, which are the RBC, WBCs, and platelets. And on the other side, you have the lymphoid cells, which are your T cells and B cells, right? So the two types are T cells and B cells, and they originate from the thymus cells. T cells are coming from the thymus cells, and that's good to know. You need to know your map. T cells produced by the thymus cells, and then the B cells by the bursal intestinal cells. That's good to know as well. A major function of the T cells is to activate the phagocytes, right? The macrophages, phagocytes, which are the cells that destroy invaders and kill disease-carrying antigens. When we talk about antigens, this is a trick, so I can remember this in a better way. Antigens, gens start with the G, right? It's a G of guest. So it's nothing produced by the body. It's coming from external sources. It's a guest, antigens. A major function of B cells is to produce antibodies, which also kills antigens, right? So that's good to know. T cells come from the thymus and B cells comes from the bursal intestinal cells. Good. Nutrition and immunity. Balanced nutrition is necessary to maintain the integrity of the human immune system. Severe malnutrition compromises the capacity of the immune system because of atrophy of the organs and tissues that are involved in immunity. What organs are involved in immunity? Our excellent favorite organ, liver, that has over 400 functions in the body between storage, metabolism, red cell production and breakdown, you name it, okay? Liver. Oh, is involved also in the glycogen production, fat metabolism, etc., etc., and the distribution and absorption of drugs, right, medication. So the liver is extremely important. I would say the most important organ in the body, the liver. Our bowel wall, which is full of villi, this little hair-like that contains a lot of functions that can protect our gastrointestinal from invaders, right? So when the villi is full of mucosity, mucus, then the villi cannot use the self-defense mechanism. That's why we are going to have atrophy, malabsorption, loss of prebiotics, microbiota, okay? Also our bone marrow that produces cells, the spleen that is in charge of the platelets, okay? Lymphoid tissue. So again, severe malnutrition compromises the capacity of the immune system because of atrophy of the organs and tissues that are involved in immunity. Liver, bowel wall, bone marrow, spleen, lymphoid tissue. Nutrition is also fundamental in combating sustained attacks of diseases. Okay, so that's good to know. Severe malnutrition compromises, okay, the capacity of the immune system. Now, we were talking about the diseases such as cancer, right? Internally derived antibodies. Bodies start with the B, which is produced by B cells, okay? So T cells are coming from thymus, B cells are coming from the bursae of the intestine, but the B cells are the ones controlling the antibodies. Antigens are the guests that are coming from external sources. So far, so good. Okay, so antibodies constitute the core of the immune system, okay, because the antibodies are the one that memorizes who are the antigens. And right now that I know who you are, I'm going to start producing different factors to attack you next time I see you. That's antibodies. A direct and simple example of the important role of nutrition in immunity is the link between protein energy malnutrition and the subsequent suppression of immune function. Again, a direct and simple example of important role of nutrition is in immunity is the link between, there is a link between protein energy malnutrition, meaning lack of good protein intake, deficiency in protein intake, in other words, and the subsequent suppression of immune function. So you have a poor protein intake. We are talking about good protein, right? Organic, good protein intake. If you have a deficiency in that, your immune system is going to be dysfunctional. That's something that you need to know. Protein energy malnutrition is important with the immune system. Healing. The constant building and rebuilding of tissue protein maintains the strength of body tissue. We spoke about this in the first chapter where we were talking about elderly, okay, and how much protein they need in order to sustain musculoskeletal, right? Do you remember that? So a strong tissue is a front line of the body defense. A strong tissue built by good protein is the front line of the body defense. This process of tissue building and healing requires optimal nutrition intake. So in other words, tissue synthesis for healing in cancer patient is an important concept. So for cancer patient, we need good tissue synthesis for healing, right? Because the tumor inside is converting good protein, good tissue, to a tumor. So that's why we need good protein for tissue synthesis, right? So the diet must constantly supply specific nutrients that include protein, essential fatty acids, and key vitamins and minerals. Individuals entering cancer treatment with suboptimal nutrition status have compromised outcomes, especially if they are going to have longer hospital stay, infection, mortality. So, as we described in the previous chapter, if you're going through surgery and you need to have a good nutrition prior to surgery, it's the same. A patient having a cancer treatment is going to go through chemotherapy, blah, blah, blah. So, the nutrition status must be balanced, if possible, before the treatment. Nutrition complications of cancer treatment. Oncologists use three major forms of medical treatment for cancer: surgery, radiation, and chemotherapy. So we have surgery, right? Depending on the site of the surgery and the function of involved organs. Medical nutrition therapy. Medical nutrition therapy may involve food texture or specific nutrients composition modifications. In the previous chapter, we covered different methods of nutrition support after surgery, right? So this is in the case of a cancer patient that is going to go surgery. Let's say colon cancer, we need to remove the tumor from the descending colon, let's say, right? So now we talk about radiation. This type of therapy involves high energy radiography beams converging on the cancer site to kill or shrink tumors. An external machine or implanted radioactive material at the cancer site administers the radiation to the body, although the goal is for only the cancer cells to die. Other cells within the close proximity of the target site may and rapidly growing cells often die as well. That's something that we need to process, and we need to know that. Although the goal is for only the cancer cells to die, that's the goal, other cells within close proximity to the target site and rapidly growing cells often die as well. So that's why protein and nutrition is so important, because we are not only killing the cancer cells, but also the good cells around this tumor. The site and intensity of the radiation treatment determine the nature of the nutrition-related problems that the patient may encounter. For example, radiation of the head, neck, or esophagus disturbs the oral mucosa and salivary secretions, of course, thereby affecting taste, sensation, and sensitivity to food texture and temperature. Resultant anorexia and nausea may exacerbate malnutrition. Okay, so anorexia is the lack of appetite, and nausea may exacerbate malnutrition. Radiation to the abdominal area compromises the intestinal mucosa, causing a loss of villi and possibly nutrient malabsorption. That's something that we explained a few minutes ago. Tissue breakdown may cause ulcers, inflammation, obstruction, or fistulas. What is a fistula? It's like a breach between organs that is not supposed to be there. We don't need a breach between liver and transversal colon, for example, right? And these conditions interfere with the normal functioning of the involved tissue. Yes, so that's good to know. The structure and function may be altered significantly after abdominal radiation, right? It's so strong. The radiation beams are so strong that can cause fistula, or maybe tissue breakdown, ulcers. Most commonly are ulcers, inflammation. Chemotherapy. Chemotherapy, the healthcare team administers chemotherapy via general blood circulation, meaning IV, right, through the body, because chemotherapy medications are highly toxic They also affect normal, healthy cells. So think about it. And a patient that is having, let's say, a stage 3, most of the time, some cancers in stage 3 require surgery first, then they are going to do chemotherapy, and then they are going to end up with radiation. Or maybe they are going to interchange between radiation and chemotherapy. So can you believe that? How much protein, how much weight loss this patient is going to have? How many normal cells are going to die in the radiation, chemotherapy, and probably after surgery? Because when they remove the tumor, they also have to remove some healthy cells around to make sure there is no little, right, hidden cancer cells that could metastasize to other organs. So this accounts for their side effect on rapidly growing tissue, bone marrow, gastrointestinal tract, hair follicles. So when the healthy cells are dying, okay, this accounts for their side effects on rapidly growing tissues, bone marrow, gastrointestinal, GI tract, hair follicles, and the complications associated with nutritional management. So we have to think about the nutrition. So in the bone marrow, there is going to be an interference with the production of a specific blood factors. Causes a reduced red blood cell count and anemia, of course, reduced WBCs, reduce platelets. In the GI tract, we're going to see patients that are going to experience numerous problems that interfere with food tolerance, such as nausea, vomiting, a loss of normal taste, sensation, anorexia, diarrhea, ulcers, malabsorption, and mucositis. That's the creation of extra mucosity in the villi. Hair follicle interference with normal hair growth results in general hair loss. So then, drug-nutrient interactions. This is very important. So several anti-neoplastic drugs have well-documented drug-nutrient interactions. And many people experiment with dietary supplements and herbs that they believe have a protective role in cancer treatment and prevention. Some of the more commonly used herbs have well-known food-drug interactions that may adversely affect patients or their treatment regimens. So I have chosen a page in cancercenter.com. So I would like you to go and review these natural supplements for cancer patients to avoid. Potentially beneficial natural supplements like selenium, folic acid, ginger, right? How can supplements affect cancer treatment? Here is the interaction. For example, herbs and vitamins to avoid during chemotherapy: garlic, ginkgo biloba, echinacea, ginseng, St. John's, kava, blah, blah, blah. Okay. Well, evidence is clear about some potential herb-drug interactions. The jury is still out on others, like antioxidants, including vitamin D, vitamin E, beta-carotene. Well, my job as a lecturer is to present you with the literature that is available and how they are presenting this fact to the students. However, in functional medicine, we have different practices, and we have seen benefits from different supplements like B17 that here is listed at we should avoid during cancer treatment. But this depends on the patient's choice of what to do, and we have to respect. But my job as a lecturer is to present you with all the information available. Okay, so let's continue. Medical nutrition therapy in the patient with cancer. Although the dietitian and the physician have the primary responsibility for planning and managing the medical nutritional therapy strategy, the nursing staff and other healthcare personnel make a tremendous contribution with regard to day-to-day support and counseling to help prevent patients meet their nutrition requirements and manage complication. Nutrition-related complication of cancer. For example, basal cell carcinoma is the most common type of skin cancer, we know that. And in most cases, excision of the lesion is the only intervention required. That's it. In such circumstances, nutrition intervention is rarely necessary. However, general nutrition obstacles may pose a challenge for patients with advanced stages of cancer, for those undergoing surgery or radiation therapy affecting the GI system, as we mentioned before. General systemic effects. Cancer generally causes the following systemic effects with regard of nutrition to nutrition status. Anorexia, which is the loss of appetite, right? That is going to result in poor food intake. Increased metabolism, which results in increased nutrient and energy needs, because if we don't have proper nutrition, the body is going to start to speed up the metabolism. What does it mean? It's going to start looking into storage, into the storage of the body, to start getting the nutrition they need. Okay, so the patient needs certain amount of energy, and nutrition is going to start looking into the storage inside of the body. That's why increased metabolism occurs. Negative nitrogen balance, which result in lean tissue catabolism, fatigue, and compromised physical function. And this is good to know. NCLEX alert. Cancer patients generally have this systemic effect, especially negative nitrogen balance. Cancer causes poor nutrition status, and poor nutrition status is associated with an increased rate of hospital admission and poor overall outcome for patients with cancer. So malnutrition, or to an extreme form of debilitating cachexia, is going to occur. A significant number of patients with advanced cancer experience some level of cachexia associated with loss, particularly older individuals. This is extremely dangerous. An involuntary weight loss with ongoing loss of skeletal muscle mass, with or without loss of fat mass, is indicative of cachexia. Let me repeat that. An involuntary weight loss with ongoing loss of skeletal muscle mass, with or without loss of fat mass, is indicative of cachexia. Clinical weight loss is generally defined, and this is good to know, NCLEX alert, because they are going to present you with cases, and they are telling you patient A in January, the weight of this patient was 200 pounds, and then in July the patient is 143, right? Something like that. So you need to identify immediately. Clinical weight loss is generally defined as more than 5% of body weight in 6 months, or more than 2% of body weight for individuals with a body mass index of less than 20 kilograms. Wow. Cachexia generally increases morbidity, mortality, length of hospital stays, and medical costs, and contributes to poor quality of life and loss of function. The best way to treat cancer-related cachexia is to alleviate the cancer and the metabolic abnormalities associated with this. And that's good to know. The healthcare team must practice aggressive nutritional therapy and medication therapy aimed to alleviating symptoms, because altered metabolism causes malabsorption of nutrients in cachexia. Effects specific to the type of treatment of cancer. Secondary problems with eating or nutrient metabolism may result in obstructive tumors or lesions in the GI tract, accessory organs, or the surrounding tissue. Such conditions limit food intake and digestion, as well as nutrient absorption. Patients with forms of cancer that involve hormone or steroid therapy, breast or prostate cancer, at a risk for significant weight gain. Because remember, steroids, one of the side effects is weight gain, right? And if you get hormones, it's the same. So fistulas, you have mucosity and cachexia, specific profound syndrome that is characterized by wasting, reduced food intake, and systemic inflammation. So let's move to loss of appetite. That's good to know. And NCLEX alert. Anorexia is a common problem in patients with cancer. And the goal is to stimulate appetite because we know anorexia is loss of appetite, right? So we need to know this. Anorexia often set up a vicious cycle that can lead to the gross malnutrition of cancer-related cachexia. The overall goal is to provide food with as much nutrient density as possible so that every bite counts. So it's nutrient density. Oral complications. So sore mouth, mucositis, altered taste, and smell acuity. Decreased saliva and mucositis often result from radiation to the head neck area or from chemotherapy, right? And this is very common. After chemotherapy, this is very common. Spraying the mouth with artificial saliva or an oral numbing solution may be helpful, but that is for a few minutes, right? Good oral care habits are important to avoid infection and to prevent dental caries. Basic mouth care includes regular dental cleaning and maintenance, examining the mouth daily for sores or irritation. Having said that, we have to use a very soft toothbrush, right? Very soft, because the tissue around the mouth is going to be already very, it's going to be weak. Treatments may alter the tongue's taste buds. Strong food seasoning for those who can tolerate them and high protein liquid drinks may be helpful. And this is important. Clients may swallow solid food more easily with the use of sauces, gravies, broth, yogurt, or salad dressing. A food processor or blender can turn foods into semi-solid or liquid forms for easy swallowing. Okay, so that also will help to these patients. Gastrointestinal problems. Chemotherapy often causes nausea and vomiting, which require special individual attention. Food that is hot, sweet, fatty, or spicy sometimes exacerbates nausea. I understand some cultures, they don't conceive the fact that you can eat food without these spices. But in cancer patient, that's something that we as providers, nurses, we need to explain and educate the family members who are in charge of preparing the food for these patients. Slowly consume small and frequent feedings or soft or liquid cold or room temperature food may ease discomfort. The use of anti-nausea drugs like your ondansetron, your Sofran, right, aids with food tolerance. Chemotherapy and radiation treatment can affect the mucosal cells that secrete lactate and thus induce lactose intolerance. In such cases, soy-based dairy substitutes, and make sure it's organic soy-based, or nutrient supplements like Ensure and Boost are appropriate alternative. I have my own concerns about Ensure and Boost because they are high in dextro, and dextrox is high in glucose, and cancer eats glucose. So I have some concerns about it. Anyway, but that's what the industry is offering us, right? That's what the literature is offering us. But we should read the labels. Sometimes it's good to read the labels. That's an NCLEX alert. That's good to know. Dietary modifications for nutrition-related side effects of cancer, human immunodeficiency virus, and acquired immunodeficiency syndrome. So, depending if the patient is having anorexia, you have to consume small, frequent, high-caloric meals. The most important is to perform frequent mouth care to relieve symptoms and to decrease aftertaste. Participate in physical activity when possible to increase appetite. So after we participate in physical activity, if possible, right, when possible, the patient is going to increase appetite. Nausea and vomiting, avoid spicy foods, greasy foods. This has to go along with the use of antiemetics and electrolyte replacement as necessary. When we are talking electrolytes, we are talking about sodium and chloride, right? Potassium, right? Taste and smell alteration. Before I mentioned in nausea and vomiting and antiemetics and electrolytes replacement, NCLEX alert, that's good to know. In terms of taste and smell alterations, also that's good to know. We need to rule out zinc deficiency. And also we use sugar-free lemon drops, gum, sugar-free. Now they use sugar-free, but when we are talking about Ensure and Boost, they have dextrose on it. Okay, gum and mints when experience a bitter taste in the mouth. Sometimes I should avoid my comments, but that's something that I like to express. Does not make any sense to me. Xerostomia. Perform oral hygiene at least 4 times per day, but avoid rinses that contain alcohol. That's helpful. Use sugar-free chewing gum, hard candy, frozen desserts, and ice pops between meals to moisten the mouth. Yes, sugar-free. Xerostomia. What is xerostomia? Dry mouth is a subjective complaint of dryness in the mouth, which may be associated with a change in the composition of saliva or reduced salivary flow or have no identifiable cause. Now, mucositis and stomatitis. So avoid alcohol and known irritants such as acid, spicy, salty, right? Supplement meals with high calorie, high protein milkshakes or smoothie. And numb the mouth with ice chips or flavored ice pops. Dehydration, use antiemetic and antidiarrheal medication as needed for relief from vomiting and diarrhea. Okay. In terms of diarrhea, use antidiarrheal medication and electrolyte replacement as necessary. And the most important is to limit gas-forming food and beverage. There is a debate between the use of antidiarrheal because when the patient is having these chemotherapies or these treatments, you want the toxic agents to be out of the body. So diarrhea is kind of acceptable. And up to a certain point, when we see that dehydration is an issue, when we see that the patient is kind of weak, so that's when we need to provide the electrolyte replacement as necessary, and in that case, the antidiarrheal medication, right? So constipation, gradually increase fiber and fluid intake. Consult the healthcare team following intestinal surgery or if there is an intestinal obstruction. And neutropenia, prevent foodborne illness as we were reviewing in previous chapters by practicing safe food purchasing and handling guidelines and limit exposure to large group of people and people with infection. That's extremely important. Wash fruits and vegetables well or peel, discard outer layer. And these two are NCLEX alert, especially the limit exposure to large group and people with infections. That's extremely important in cancer patients. NCLEX alert. Okay. So loss of lean tissue, dietary supplements. Okay. Okay, thank you. Containing fish oil may be effective at preserving or improving lean body mass in adult oncology patients experiencing unintentional weight loss. The dietitian may recommend a dietary supplement or a medical food supplement containing fish oil with 1.2 to 2.2 of EPA, eicosapentaenoic acid, daily as nutrition intervention for individuals who continue to lose weight and lean body mass. Pain and discomfort. Before going to this, I want to introduce you to Dr. Berg, and he's going to talk to you about the EPA and DHA. That's something that we need really to know.
What would happen if you started consuming omega-3 fish oils for 30 days? That's a topic I want to educate people on because omega-3 fatty acids are essential. That means that our bodies can't make them, but we need them. And 70% of the entire population is deficient in omega-3. And I'm going to tell you why they are deficient. And I'm also going to tell you what would happen if you started putting these omega-3s back into the body. And you can do it through several ways. Fish oils. Fish oil is one way. I prefer cod liver oil because it also has two additional things like vitamin D and vitamin A, both which are not in fish oils. You don't want to buy a fish oil based on cost because you're going to basically get rancid fish oils and they're going to cause more harm than good. And this is because fish oils are highly susceptible to being oxidized. But of course, the best thing to do is to consume actual fatty fish, sardines, grass-fed beef, organ meats, and even eggs. Now, I will mention about, like walnuts, flaxseed, hemp, chia seed might say they have omega-3, but really they're precursors that turn into omega-3 fatty acids. They have something called ALA, and then that can convert into EPA and DHA. EPA primarily helps you reduce inflammation, okay? And a lot of people have inflammation, and you can have inflammation in the joints, so it helps with arthritis. You can have inflammation in the heart, so it can help with your heart. And then you have something called DHA, which is really good for your brain. In fact, your brain is made up of 20% DHA. And I'm talking about the gray matter, the cerebral cortex. This is why fish oils are really good for memory, cognitive function, attention, focus, learning, really good for kids, yet many kids don't consume fish or fish oils. But there is a reason why your parents or your grandmother gave you cod liver oil, because that's more of a well-known remedy for so many things. That a lot of the Nordic countries used cod liver oil back in the day when they had long winters with very low vitamin D, because as we know, we don't get a lot of sun during the winter, and a lot of people become depressed during the winter, and they might have a worsening of their arthritis. So cod liver oil is an excellent source, or just consume more fatty fish through the winters. Now, another interesting benefit with cod liver oil, especially for kids, if you can get them to consume it, is asthma and allergies. And it's a combination of just reducing inflammation in the lungs. I mean, what's an allergy? It's like you have a lot of inflammation. But also the vitamin D is one of the most potent anti-inflammatories, and vitamin D is one of the most important things in asthma. This is why if asthmatic kids get more sun, their asthma goes in remission. So normally people take omega-3 fish oils for heart problems or brain issues, but they are good for other things too. So if you consume them on a regular basis, you may find one of the following symptoms disappear. Dry eyes. Now you can also help dry eyes with vitamin A, but also with omega-3. The next one is dermatitis, especially if your skin is scaly and dry. And so when you're deficient in omega-3, you can develop what's called age-related macular degeneration, affecting your sight. I already mentioned all the arthritises, both rheumatoid and osteo, and arrhythmias, and high blood pressure. Another really interesting benefit is improving a fatty liver. That's right. By taking a certain fat, you can get rid of fat in your liver. Another great benefit for omega-3 is increase calcium absorption. Now, of course, if you take the cod liver oil, you're going to get more calcium absorption because of the vitamin D. Vitamin D helps you absorb calcium by a factor of 20 times. I notice when people are deficient in calcium, they can have leg cramps, but they also have a hard time going to sleep easily. They might be tired, but their head can't relax or go to sleep. And
So right there, this is the second channel that I am suggesting you. In the previous chapter, I was talking about a channel that has very nice information for NCLEX. This doctor has close to 14 million subscribers. He is a master in nutrition and functional medicine, and you can learn a lot from Dr. Berg. So I gave you already the information. He was very informative in relation to EPA and DHA and the reduction and inflammation. DHA works on the brain and EPA works in the inflammation in the entire body. Okay, so there you go for cancer patients. And that's why they ask you to supplement yourself with fish oil. Make sure that fish oil has EPA and DHA components in the formula. Okay, that's the basic, the summary of this. When you buy fish oil, make sure there is a component of EPA and DHA. Pain and discomfort. The current medical consensus is to administer pain controlling medication as needed in close consultation with the patient and their care provider. But consider that constipation is a common side effect of several pain medications. So preventive therapy to avoid additional discomfort from constipation should focus on adequate liquid fluids. We know that. Soluble fiber and regular physical activity. Those are the triad, the three components for preventing constipation: fiber, fluids, and regular physical activity. Nutrition care plan, we are going to make an assessment. The oncologist or dietitian should evaluate all cancer patients for malnutrition, and there are validated and reliable assessment tools, like for example the malnutrition screening tool, the malnutrition screening tool for cancer patients, or the one a universal screening tool. So the intervention, basically the objectives are to prevent nutrients deficiencies, to maintain or improve lean body mass, strength, energy, functional availability, and identify and manage nutrition-related side effects of cancer and treatment modalities. Prevention of catabolism also is one of the goals. We need to meet the increased metabolic demands of the disease process in an effort to prevent extensive catabolic effects and tissue breakdown. Maintaining nutrition from the beginning is far more efficient than rebuilding the body after excessive wasting. Huge statement here. What they are telling you is that we need to maintain nutrition or prepare the body for the treatment or the surgery at the beginning is better than put the body in rebuilding after the surgery or after the cancer therapy. Okay. Dietary supplements containing EPA and nutrient-dense nourishments, ensure boost carnation breakfast essential, may benefit the patient and help them to meet nutrient needs. And that's good to know for cancer patients. It's important to recommend small meals in this sense, right? Now, there are clinical applications, and here you have an informative study in terms of cannabis as a treatment for anorexia, which is really helpful. Let's be honest. Energy. An adult with good nutrition status needs approximately 25 to 30 kilocalories per kilogram of body weight for maintenance requirement. And that's good to know. Kilocalories, okay? Patients may need more kilocalories in accordance with the degree of metabolic stress. Yes. The amount of anabolism that is taking place and their physical activity levels. A malnourished patient may require significantly more energy depending on the degree of malnutrition. However, refeeding syndrome is also a risk for these individuals. And now anorexia, diarrhea, cachexia, nausea, malabsorption, fever, xerostomia, pain, infection, and early satiety are all examples of complications that will alter a patient's energy needs and consumption. So then protein, that's good to know. Again, protein. Adequate dietary protein is necessary for tissue building and healing and to offset the tissue breakdown that the disease or the treatment causes. So efficient protein use depends on an optimal protein to energy ratio to prevent catabolism. An adult non-stressed cancer patient with good nutrition, for example, needs 1 to 1.5 grams or kilograms per day of protein to meet maintenance requirements, with an emphasis of high quality protein sources. Malnourished individuals need an additional protein to replenish deficits and to restore a positive nitrogen balance. So high protein consumption can put pressure on the kidneys, and that's something that we need to avoid, because we are mentioning that good high intake of protein is necessary for healing. But if you consume a lot of protein, also you're going to put your kidneys in danger, because it may cause, right? It may cause problems in the kidney functions. So be careful with that, okay? Okay, especially because the kidneys can go through glomerular injury, or also eating a lot of red meat can create more acid and toxins in the body, putting more pressure in the kidneys. So here I would like to address the ketogenic diet, because many patients believe that by eating protein they are following a good ketogenic diet, and they start eating more red meat. Seriously, I've seen patients that are eating steak, breakfast, lunch, and dinner, right? Breakfast, lunch, and dinner. And who knows if they are having the budget to buy grass-fed red meat. So they are putting their kidneys in danger. Okay, vitamins and minerals. An optimal intake of vitamins and minerals, or at least to the dietary reference intake standards, is ideal. I would say we need to speak with a nutritionist in order to select good supplements, vitamins and minerals, right? Some individuals may require these vitamins and mineral supplements to ensure dietary intake. So the registered dietitian who specializes in oncology, especially, right, can assist patients in sorting through the supportive data on dietary supplements for specific forms of cancer and specific forms of treatment. Okay, and we need to consider that with talking about protein again. Malnourished individuals need additional protein to replenish deficits and to restore a positive nitrogen balance, because major systemic effect in cancer patients is negative nitrogen imbalance, and that's good to know. Major systemic effect in cancer patient is negative nitrogen balance, because the waste of lean mass, right? Okay, so we have the antioxidants and chemotherapy, and the complementary and alternative medicine, the CAM, is a diverse set of healthcare system products and practices that are not generally considered part of conventional medicine. This type of treatments includes dietary supplement use, acupuncture, massage, herbal medicine, and mind-body techniques. And is most notably dietary supplement use is highly prevalent in individuals with cancer. Yes, many cancer patients are using this alternative medicine. Cancer patients have used antioxidant supplements, particularly mega doses of vitamin C, that we know is good for healing, in an effort to boost their immune system while undergoing cancer treatment, or as the sole treatment method. So, what we know about vitamin C is good for the immune defense, right? However, our textbook is telling historically this practice has been controversial primarily because of the lack of high quality clinical trials to support either the safety or efficacy of the practice, because vitamin C is an antioxidant and some chemotherapeutic agents specifically use oxidative stress to target the cancer cells. Healthcare professionals speculated that simultaneous vitamin C treatment would reduce the effectiveness of the anti-cancer treatment. That is why it's a controversy. One study found that even a typical oral supplement dose of 500 milligrams per day, vitamin C prevented the cytotoxic effect of anti-neoplastic agents from killing tumor cells, not just healthy cells. In other words, the vitamin C protected the cancer cells. This is a huge statement that is controversial. Anyways, resveratrol is a phytochemical found in berries and other fruits with anti-cancer and antioxidant activity. Yes, I know resveratrol it used to be very cheap, very affordable. Right now it's very expensive, but it's really effective. It is also available in dietary supplement form, and individuals commonly use it as cancer prevention prophylaxis and an adjunct to cancer treatment. In vitro studies suggest that the resveratrol increases tumor cell response to the effects of chemotherapy agents and increases apoptosis. What is apoptosis? The cell itself is going to destroy of breast cancer cells. Yes, resveratrol is very good. So now we are heading to fluid. Fluid balance is essential to replace GI losses from fever, infection, vomiting, and diarrhea, right? So we encourage patients to drink at least 1 cup of fluid for each incidence of diarrhea. In case of which dehydration persists, the healthcare provider may order intravenous fluids. That's very common because sometimes we prefer the patients but to have some level of diarrhea, but not diarrhea every day, all day, right? So ample urine output is favorable for toxin clearance. Exactly, and not only urine, but also the diarrhea is going to get rid of the toxins. So we are going to support that fluid imbalance with intravenous fluids, okay? Better, depending on the case, don't take me wrong, but better than anti-diarrhea, which is going to keep the toxins inside. Enteral and parenteral nutrition support. Patients without a functioning GI tract and patients who cannot tolerate enteral feedings may require parenteral feedings for nutrition support. And we know that from the previous chapter. And also we have to monitor and evaluate the treatment. Cancer prevention. Experts estimate that 42% of cancer cases in adults are the result of potentially modified lifestyle choices. Yes, this is true all the way. So diet, physical activity, alcohol intake, smoking, UV radiation, obesity, all of these are modifiable lifestyle choices. The American Cancer Society, the American Institute for Cancer Research, and the World Cancer Research Fund International highlight the significance of a healthy diet and regular physical activity, and their cancer prevention guidelines. In addition, the U.S. Food and Drug Administration has approved specific food labeling guidelines for associating certain foods and nutrients to the decreased risk of cancer. So, guidelines for cancer prevention: number one, be as lean as possible within the normal range of body weight, right? So, we have to lose weight, we have to avoid overweight and obese status, adopt a physical active lifestyle, go for a walk, swim, ride your bicycle. The fact is that we need to limit sedentary behavior. Number three, consume a healthy diet that has an emphasis on plant-based food. Okay, that's why here we need a nutritionist, because we have been talking about the high intake of protein, right, for healthy musculoskeletal and also to support energy. So now we're talking about plant-based food. So we need to talk to a nutritionist to get all the information necessary and to select good food. Limit the consumption of salty foods. Okay, limit the consumption of energy dense foods, particularly processed food that are high in added sugars. Choose a variety of different fruits and vegetables. Choose whole grains instead of processed refined grains and sugars. Choose fish, poultry, and beans as alternative to red meat. Select lean cuts and small portions and prepare the meat by baking. This is important. Broiling or poaching rather than frying. Avoid processed meat. Number four, if alcohol is consumed, limit intake to 2 drinks per day. I totally disagree with that. You are authorizing an adult to get 14 glasses of alcohol in a week, which is huge. And then 1 drink per day for women, 7 glasses of alcohol in a week. That's a lot. It doesn't matter what type. Still, alcohol is not good for you. Meet nutrient needs throughout diet alone. Do not rely on dietary supplements, right? And then dietary choices and physical activity are the most modified risk factor for cancer prevention. One study including more than 476,000 participants followed for 10 years reported that adherence to the preceding guidelines significantly reduced the incidence for cancer and mortality in both women and men. So we have the health claims, and we spoke about this in the previous chapters about the dietary lipids, the fiber containing grain products, and the fruits and vegetables, and cancer. Cancer research, right? As previously mentioned, some studies have shown that diets consistent with cancer prevention guidelines are associated with decreased incidence and mortality rates for various cancer. For breast cancer, excess body fat considerably increases the risk for breast cancer through several metabolic and inflammatory pathways. Colorectal cancer, over 1/3 of colorectal cancer incidence is attributable to dietary factors and physical inactivity alone. So diets rich in whole grains, fiber, and calcium appear to be protective against colorectal cancer. Gastric cancer, a diet rich in fruits and vegetables such as the Mediterranean diet, which we spoke about before, appears to be protective against gastric cancer compared with the typical Western diet. So diets and supplements, okay. The Academy of Nutrition and Dietetics Nutrition Care Manual reports on the following non-evidence-based diets and supplements that are commonly associated with cancer. The Gerson diet, okay, which is a diet rich in juices, carrot juice, and plant-based. The Gonzalez diet, that is a plan rich in pancreas enzymes, the acid-based diets, macrobiotic diets, high-dose vitamin C supplements, you name it, okay? So they are talking about here that there are some controversies and non-evidence reports in terms of these diets, which in fact are really well known in the market. When we talk about the oncology therapies, these alternative therapies are very well known. Complementary and alternative medicine is commonly used by individuals with cancer, but less than half of those clients on average disclose that information to their oncologist. Yes, they don't want to tell the oncologist, doctor, I am using the Gerson therapy, I'm using the Gonzalez diet, because most of the doctors don't trust these therapies. Because in fact, there is no much money available to pay for research for these therapies. There is more money available to do research on chemotherapies. So that's why many patients, they don't share that they are following this type of therapies or diets. Alternative practices that may have nutrient or drug-nutrient interaction potentially include specific diets, supplements, herb infusion, enemas, for example. And we finished the review of the nutrition for the cancer, right? Nutrition support in cancer. And when we come back, we are going to start the nutrition support for patients with HIV. Thank you.